involving COVID and situation in Monroe. So, Steve, would you like to make some comments?
Yes, sir. From the beginning, we've been at the battle against the COVID virus in our system for about 5 weeks now. It's been about 7 days a week for 5 weeks, and have some dedicated staff that have pretty much dedicated their life to this at this point. And we've implemented a number of strategies within this system, and that includes active screening for all individuals that come into the system. So everybody reporting to work, they'll go through the screening questionnaire, have their temperature checked, and be cleared to come into the workplace. Weeks ago, we had stopped all visiting, and so we did everything we can to limit the number of people that come into our correctional facilities and our work release facilities. Additionally, out in the community, we have taken some steps to reduce contact with our CCOs and incarcerated or the supervised individuals in our system. We have active cleaning, sanitation going on throughout the state, hard surfaces, light switches, things like that, at all of our facilities. And over and above that, we're encouraging hand sanitizing. We've provided free soap to incarcerated individuals. We continue to do that. And as the virus has now touched one of our facilities, we've also crafted over the last 5 weeks probably 13 versions of protocols, evolving and making those better every time. And those protocols go in place when we have the case come into the system. And as an example, those protocols would be that an individual showing flu-like symptoms would be placed in isolation. We would test them while they're in isolation and make a determination whether or not they need pain on their COVID positive. Beyond that, other people that may have had contact with people that were known to have the virus, we as a precautionary measure would place them on quarantine. And we broadcast those numbers out on our website, doc.law.gov, and we update all those numbers daily. So moving forward to the Monroe Correctional Facility, last Sunday is when we had our first case of active COVID within the system. And with that individual, we immediately instituted contact mapping to identify those he may have had contact with, and we immediately put 6 additional individuals into isolation status so that we could test them. At that time, we also started making moves to move people that we identified as potentially vulnerable based on CDC guidance and take extra precautions for those individuals. There was some resistance to that, but we continued, and I believe it was the following day that test results came back on the other 6 individuals indicating that they were COVID positive. And so we intensified our efforts to move the more vulnerable individuals to different housing situations to better protect them, and that was met with resistance. At the same time, another living unit was placed on quarantine, and they broke the quarantine, and a number, I will say, 50 or so individuals went out into the recreation yard contrary to the quarantine, and really that puts people at risk. Not only the individuals that are on those quarantine staffs, but everybody else around them that could potentially be infected. So really disappointing situation. We've worked really hard since last evening. After they broke the quarantine, they went into a smaller number of those individuals engaged in some activity and essentially vandalizing the living unit. And those individuals, we responded to that, were able to regain control of the unit relatively quickly, and so we had to move those individuals out of the population. So today we continue our efforts to move people around within the system to give them a level of isolation so that we can better protect them. But truly, it takes everyone's help and cooperation in this. I'm extremely disappointed by what we saw at Monroe, which hasn't been consistent with what we've seen from the other populations around the state. And so there's been, a lot of cooperation in a lot of other facilities, and frustrated individuals actively engaged in wiping things down, following social distancing rules. This didn't go the same way at the Monroe Security Unit. But again, we spent a large part of the day today and feel that we're going to be able to move people to better places. In addition to the all the protocols we put in place in the system, we have started looking at individuals that we could, non-violent drug offenders and people like that within 60 days of release, that we could potentially move out sooner. So we're working on some options for that. And so we're taking all of the steps that we can possibly take. And I say that, and then every day we learn new information. And with that new information, we're responsive, change protocols if it requires that, and continue to improve and evolve our processes. And that's about what I have at this point, and I'm open for questions. I do apologize about being here in a t-shirt. Didn't realize I was going to be at a press conference today, and haven't had a need for a suit in a few weeks in the Emergency Operations Center.
Thanks, Steve. I'm going to make some comments, and then we'll come to questions of Steve and myself as appropriate. I'll talk a little bit more about the Monroe situation, but first I do want to address the situation of the state of Washington in general today about what is the most important issue in my view, and that is the sun is out, the daffodils are beautiful, it's warming up, but I just want people to fundamentally understand that this virus is just as deadly and dangerous to the well-being of Washingtonians as it was on March 23rd when I announced the Stay Home, Stay Healthy initiative. And that is clear. And the good news is that decisive action that we have taken has dramatically changed the current estimates of the eventual fatalities that we will suffer. But here's the deal. Any backsliding that we experience, any reduction in commitment to this social distancing, any refusal to respect this Stay Home, Stay Healthy initiative means more people are going to lose their lives in the state of Washington. And that's important to say because given some of our early success, given the fact that the sun is out, it would be really human for us to take our foot off the pedal here. But that is just too dangerous. And I just want to reiterate that message. To me, it's the single most important thing we need to think about in the state of Washington right now. Addressing the situation in our corrections, I think from Steve's comments, you've seen that the department has been preparing for this for some time, addressing protocols to reduce the risk to everyone. And when I say everyone, that includes incarcerated individuals, and it also includes our hardworking staff that are working in our prisons. I've had multiple briefings from the department last night about the situation in Monroe, and we know that we want to work to protect everyone involved. It does require cooperation. I'll ask Steve to note that we have been trying to get some of the people who are more vulnerable, some of the older incarcerated individuals, to go into isolated facilities so that they can be less exposed to this virus, and they have refused to go, and that's been disappointing. Today our medical staff has been talking to them in the hopes that they will protect themselves like we hope that they will do so. They've got family that care about them outside, and we hope that they will help us in that regard. I have been in touch with staff in the weeks leading up to this and continue to be involved. We are looking at ways to reduce the number of individuals to free up space that then can be used for the isolation that would be helpful to everyone concerned to reduce the risk of COVID-19. I think public safety calls for that, and we're looking for reasonable things to do for some nonviolent offenders. So we'll have more to say that in the days to come. A few other updates. Our efforts on acquiring personal protective equipment, PPEs, are ongoing. We've made substantial progress in the last couple of weeks. We now have 85 million pieces of PPE that are in the pipeline heading to the state of Washington. And these are great investments, and I'm happy that we have made substantial progress. But there are still frustrations in our institutions of our hardworking nurses and doctors who, as of yet, are still having difficulty with PPE. We're glad we have a recycling technology now available here. I believe it's in the Olympia area, which should also be helpful. They can do thousands of these to recycle them to increase that protection. Today, the Department of Labor and Industries issued specific guidance for grocery and retail industries for protecting workers. It includes guidance on physical distancing and sanitation to protect our workers, that protect us and serve us. It requires basic education for all workers to help to stop the spread of COVID-19 and how to protect themselves and their co-workers. We are still very active in our effort to increasing the testing capability. I have been on the phone recently with a variety of companies across the United States trying to obtain supplies of things as simple as medical swabs that are used in our testing kits. And we've made some progress, but not enough. And we are continuing that effort. It would be most helpful if the federal government also helped us by mobilizing the manufacturing base in the United States. We continue to call on the federal government to help us in this regard. I'll just finish on some of the good news that we've heard, and we're hearing these stories, and I'm sure you have heard them as well, about the people who are inspiring us across the state. I read a Spokesman Review article about a Gonzaga University student named Eleanor, who found some extra time on her hands, and she's using her time to help others. She's volunteering at the Spokane County Fair and Expo Center, working to help screen patients for COVID-19. Thanks to her. I read a Seattle Times article about Ming Tung Edelman, who started the Refugee Artisan Initiative in 2016 to create jobs for immigrant and refugee women. They're now making masks, and they've transitioned their efforts, and they've sold 1,200 masks already that have gone to hospitals in Monroe and Bellingham. We're seeing that all over the state of Washington. Thanks for everybody who's pitching in. And with that, happy to stand for questions, or feel free to ask Steve questions as well.
First question will go to Martha with AP. Okay. Can you hear me?
Go ahead, Martha.
Yeah, isn't it true that you have a number of inmates who have already approved, they have approved release plans? Why not just release them now?
Steve, you want to address that?
Yes, certainly part of the transition process includes developing a release plan, and some of those individuals would probably fall in the group of people that we're looking at. So some of those it depends on the individual circumstance.
If I can, in a lot of these release plans, it's been involved helping to prepare an environment, jobs, help, residential help with drug and alcohol counseling, so that the incarcerated individual doesn't reoffend. And the department has that, wants to help these folks to continue in that path. What we're considering is how to shorten that process to allow people to get out into public as quickly as possible, and that, I think you're going to hear some further discussion about that in the next few days.
Next question we go to Essex with Kyra.
Yes, a question first for Mr. Sinclair. People might be puzzled to learn that inmates are resisting the idea of moving to safer isolation. Why are they resisting? What do they say? And Governor, why has it taken so long to get to this point where still few, if any, have been released from prison to make more room for isolation?
Steve, you want to talk about what they're saying?
Yes, sir. So with the individuals, recognize that when they move to a different setting, we're trying to allow them to take all their property with them and access to all the future comforts like JPay devices and things like that. And it's not possible in all situations, but we are trying to make that available wherever they go to make that stay in isolation as comfortable as we can. And the release options, we have certainly been tracking our population that's coming in and out, and we're not over capacity, and so we do have the ability to provide isolation for a number of folks. As part of our preparation and planning, which we actually do every year just for the influenza season, is about identifying isolation space in all of our facilities so that we can house folks. And, you know, the governor's pointed out and what people are, we're willing to be creative if the need exists, and that's pulling RVs into the recreation yards. We do that, where we just haven't quite got to that point. And hopefully we'll maintain our defense against this and limit the cases that we don't get in that situation, would be my hope.
I'll just share a little bit because Steve was too politically correct to fully share some of the information about this. Look, some of the social networks in these institutions, there's a camaraderie viewpoint, and that has, Steve has related to me, some of the folks have said they want to stick with the team, and the team wants to demonstrate disenchantment at the moment. But this is really important for the safety of these individuals. We are making provisions for them, and we're really hopeful that when cooler heads prevail, that they will avail themselves of this offer to go into a safer situation. And as Steve indicated, they are considering trying to get them into existing cells, but to do that, people have to move out without violence. We don't want violence. We don't want to expose our staff to that. And if there's other measures of getting RVs in the grounds, these are other things that are under consideration. So we just hope people want to care for themselves, and that'll be a good result. As far as why we're doing this now, it's because I have 7 million other people who I care about, and I've been working 24/7 for them. And we approach these things as they become time critical, and this is time critical, and we're acting accordingly.
Next question comes from Joe with the Seattle Times.
Two questions for the Secretary. We've heard reports that I suppose some of the prisoners were worried they were going to be moved to a part of the prison where others had been living where they tested positive, but also possibly into a room with 45 beds that didn't have enough spacing for social distancing. I'm curious to get a more specific account of what DOC was asking or directing prisoners to do yesterday. And we also heard that Washington State Patrol officers were around at the prison Wednesday morning. I'm curious if you were anticipating trouble earlier in the day from some of these requests.
The answer to your last question is no, we weren't necessarily anticipating trouble. And on the specific location that they were working on to move individuals into, the description that you provide, is it consistent with what I know? We were looking to move them into other rooms that would be similar to the rooms that anybody else would be in. You know, sometimes if people aren't paying attention or not listening to what we're trying to do for them, they perceive things that aren't completely true. So I can't endorse everything you said because it's not consistent with what I know.
If I may add something, the situation is that if we're going to provide safety for some of the more vulnerable people in the population, people over the age of 65, the people who have underlying health concerns, some of the other inmates might have to give up their television for a certain period of time. And we just need a little cooperation to do that. Now, we are getting cooperation from many, many of the incarcerated individuals. At one of the other prisons, they're actually making surgical gowns that are going to help people, surgeons and nurses in our hospitals. We think that's great. So we're getting a lot of cooperation from people who are in these institutions, and we just hope that that will increase.
Next question comes from Drew Nicholson, 15-5.
Question for Secretary Sinclair. You mentioned Monroe. As you know, inmates are moved around quite a bit. We've been getting calls from inmates at Great. And other facilities that say inmates from Monroe have come there and they have not been isolated. People are still sleeping in bunk beds on top of each other, beside each other. What's happening at the other facilities where inmates potentially from Monroe have gone?
Right, so Monroe is a large facility of itself. There's actually about 4 different perimeters that exist there. And the one location where this was at the minimum security camp. And so we did go back as part of our mapping process to identify those individuals that had transferred out in the last 14 days, all of them to a new location, check their status with food temperature and those kind of things, make sure they're healthy. And so it is a little different throughout the state. At our camp level facilities or the work releases, a little more challenging because there are some, if I say dorm, I don't mean like a college dorm, but you have bays with bunk beds in them, and those exist at those lower security levels. And those certainly are our most challenging. Why we're looking at the reduction in capacity is just to get at that and create some more space for social visiting.
Next question, we go to Greg with Reuters.
Hi, Secretary Sinclair, are you using solitary confinement units for folks that need to go into isolation? And also, if you could comment, are you learning anything from the outbreak in Cook County, Illinois, which apparently is now the largest, the prison there, which is apparently now the largest single outbreak in the United States? Any lessons learned for our correctional facilities?
Actually, the first question he asked relates to whether or not we're using segregation beds. In some cases, that may have to be a temporary housing for some individuals initially going on this, and certainly if their conditions became worse, they wouldn't remain there. So yeah, that could be an option at some facilities. And related to the Illinois case, I have to be honest with you, I haven't had a lot of time to watch TV, and we haven't looked at that. Since we were one of the first states affected by this, we've been helping to inform a lot of other states with our practices and protocols that we've put in place. I know that the doctors that are working so hard for us help inform the CDC guidelines related to correctional facilities. So, yeah, we've been doing pretty well in comparison to some other places, unfortunately. Yeah, so we're continuing to evolve and continuing to improve.
Next question, we go to Jim Camden with the Spoken Review.
Governor, look at inmates to release if you're going to be looking beyond non-violent drug offenders, and if people who are released, are they going to be tested before they're released to make sure that they are not COVID positive? And I'm also wondering if any of the people who have tested positive have developed symptoms so bad that they've had to be hospitalized.
Steve, you want to ask that second question or answer that second question?
Sir, so we had one individual who tested positive for COVID-19 that wasn't actually in a facility. He contracted it out at a hospital and remained at the hospital. So he is still there. And then the first individual from Sunday also is down at a hospital. The report this morning was that he was doing better. And so that's where I know about that one. What was the second part of your question?
Well, the question was, will they be screened if they are released?
As part of our release process, we do screen everyone, and we want to make sure that if somebody is symptomatic and they're coming to the mandatory end of their sentence, that if they are showing some type of symptoms, that we know that and connect them with some kind of county health resource where they're at.
Okay. Go ahead, Emily.
Next question, we go to Keith Elridge with Como.
Will you hear me this time, Governor?
I'm sorry?
Go ahead, Keith.
Make sure you can hear me this time. We had technical difficulty.
Go ahead, Keith.
Go ahead, Keith. I hear you.
All right, thank you. Just checking to see if you're going to push back the stay home, stay safe, stay healthy, ask forth whether you're going to include more
Well, our order is through May 4th. We think that was the safe thing to do, and it followed the science. We'll continue to follow the science. It would be possible to extend it. No decisions have been made about that, and we will make decisions based on the data that is in existence at that time, so we have the best and latest scientific information. So we know it's through May 4th. We can't tell you the further decisions in that regard. Regarding some construction, we are in talks with some of the construction industry to see what could be a safe way to be able to start residential construction at some point in the future. And those talks have been helpful to see if there's protocols to be able to keep construction workers safe. I do want to say, though, residential construction is not allowed at this time under the court order or under our order, and that's for the safety of everyone concerned. So we're going to follow this data wherever it leads, and all I can tell people is we can remove this the sooner the better, and the more that we follow this order and don't go clog up the park sitting right next to people, and senior citizens can try to avoid some grocery store visits so that they have less transmissions. We have this control. It's what we do that's going to determine how fast we can lift this order.
Okay, next question, we go to Dan on Fox.
Hey, Governor, thanks for taking the question. I don't have the latest numbers from the state, but I see that in King County there were 198 additional cases today and 14 additional deaths. I want to know what data convinced you that you could return the Army Field Hospital at CenturyLink and return 400 of those 500 ventilators you got from the national stockpile?
Yeah, well, the data was several parts of the data. Number one, the hospitalizations with COVID-like symptoms. These are people who come into a hospital and they have symptoms that could be COVID before it's ruled out. That went up but then has been stable and now is coming down to some degree, which is really a good sign because that's kind of early in the course of people's treatment. It's the first day they get to the hospital. If they do have a poor result, that's sometimes 10, 12 more days after that. So that data, we hope, is a precursor of seeing this curve start to head down. Another fact is the rate of positivity of the number of tests that are positive. That has tended to stay stable or gone down just a tick. A third is the compliance rate of Washingtonians with our order. It has been very high. We've reduced social or physical interactions anywhere from 50 to 80%. There's different data. There's traffic data. There's data from cell phone usage. And that has shown a high level of compliance so far. So good in that regard. And then the fatality themselves have been relatively stable. Every single one is a tragedy. Every single one of those numbers represents people whose loved ones won't be with them. And we should never be lulled into thinking these are just numbers. Every one of these is a loss to a lot of loved ones. But that has been, thankfully, relatively stable. We can't wait for that to start to go down. And I hope that'll happen soon. But we got to keep that number going down because the epidemiologists have told us that if we stop social distancing, that number will start to go up again. In fact, we showed a graph this morning that I will distribute to you that you might want to share with your audience that shows that, about why it's important to continue our efforts even though the fatalities go down. It's just as important, maybe more important. It's harder. It takes more dedication. It takes more team spirit. It takes more commitment to your community. But it certainly is necessary. Now, we also listen to the experts of our public health officials and multiple modelers, including Dr. Murray at the Institute for Health Metrics, who is really one of the preeminent modelers that the world is turning to now. So we have a wealth of talent to draw from here in Washington State.
Next question comes from Jim Drew with the News.
Let me add something, too, if I may, to that previous answer. The reason we were able to release the ventilators in the hospital is because we have very high confidence that we will have adequate medical facilities and ventilators to respond to this. And that was after a very detailed assessment with Vice Admiral Raquel Bono, who is leading up our hospital efforts. She came in as an independent leader, and she's been very successful assessing our hospital capability. And she and we are very confident that that exceeds, because we have surplus capability right now. So we have beds that are not in use right now. We've got slack that's going to be available in the event that there was an uptick of the disease. And we have seen the horrific suffering of places like New York and Louisiana, and I just saw a terrible story coming out of Detroit. And these assets, which are national assets, can save people today in those places. And those are Americans. So we made a decision to send that help. I think it's the right decision.
We have time for a few more. Next is Jim Drew with the News Review.
I just had a question for the Secretary. First question is whether the DOC's reported number of staff intentions are uncertain because DOC itself is not testing any staff members. Instead, it's relying upon self-reports from staff, and that DOC has no independent verification regarding the number of staff who are or have been infected with COVID-19.
Yes, it's true that we do rely upon the staff. If they receive off-site, it's all off-site testing. We don't have the ability to test, only send in to the testing facility. So yes, that is true. We have to rely on them, and we also rely very heavily on our screening process and the temperature checking and all of that. And even in my building, with the 2 people that we have here run the Emergency Operations Center, we're pretty diligent about checking each other and holding people accountable if they look like they're not following the rules.
So next question comes from Hannah Scott with Coyote Radio.
And I think, Secretary Sinclair, I think you just answered my question. We were told last night by one of your staff members that you simply don't have enough tests to test all of your inmates. Did you just cover that?
And it's a different topic than the previous question. And we do have test kits to test individuals, but we follow the DOH guidelines, which outlines a process of triage that you go through to try and determine if the COVID testing is necessary. And so we follow the same protocols. We've done, I'm looking at numbers here, about 380 tests within the system for people that met those criteria. Of that, 6 obviously have been positive, and we're pending results on 54. And so our test kits, we've been able to meet that need, but in anticipation we have requested more from the state EOC, and they've been responsive with providing what they can.
Next question comes from Pablo with Univision.
Thank you, Governor. A couple of weeks ago, you signed House Bill 2640, clarifying that private detention centers are not essential businesses. Is the ICE processing center in Tacoma complying with state law as they continue to operate?
There's a question about our jurisdiction over federal facilities, and that is something we have to continue some investigation on. So I'm going to defer my answer on that, and I will try to get you an answer as soon as I can as that becomes clarified.
Next question, we go to Inslee with KOW.
Hi, yes, we've heard from the Department of Corrections and that they're not requiring staffers to wear masks. So advocates for inmates are saying that's endangering the safety of everyone. I'm curious, what's your response to that?
Yeah, well, we are going to require it. You're a little ahead of me. That's sitting on the desk next to me, and that's going to get pumped out to all staff. And we're also trying to, as resources become available, get face coverings on our incarcerated individuals as well. And so in our perfect world, we'll have everyone with some level of face covering, just like I see every day when I go to the grocery store. I'm kind of an odd man out. I need to get one of those masks myself.
Next question, we go to Jerry with Ever Herald.
Secretary Sinclair, that was another question that I've heard come up, a couple of them, is why on Sunday, when you had your first positive result, wasn't the minimum security unit immediately sanitized and steps taken to immediately deal with the facility and the safety of the facility? And secondly, are you looking about stopping the intake of new inmates, including maybe violators of parole, just stopping the intake of new bodies?
So the first part of your question is that the protocols that we're using are consistent and sometimes exceed what CDC and DOH require. And so it comes to quarantine and isolation processes. We try and take that even more conservatively. And evacuating 480 individuals would probably spread, if there was an outbreak, to even more locations, and it would be a bad health practice. And then, could you repeat your second part of your question again?
And then the intake of new people, new inmates, maybe people who violated parole, I think are brought in for the short term. Why hasn't that process just stopped, at least now, until you can get this under control?
So overall, there is a weekly number of individuals that come into the system, new admits from counties of conviction. That has slowed down. I think it was about 20% that slowed down since this has started. And when it comes to violators, we have reduced the number of violators coming in by about 66% is what I recall. We've seen a significant reduction in that. And certainly all these things are being considered and talked about, and we see the criticality of it, and we're being as responsive as we can based on current statute.
Last question?
Yeah, I may note that some of the counties have reduced some of their county jails by just turning over their inmates to the state. And this has been a bit of a challenge, but if I understand Steve correctly, we have reduced by about 60% the number of people who are coming in for violations of their conditions of release. And that was a rational thing to do. But crime has continued, unfortunately, and we have to deal with that.
Okay, and final question. We'll go to Simone with 213.
Hi, Governor. I wanted to get an idea of the scope of your consideration for releasing individuals. I spoke to a husband of a woman who is in the residential parenting program and is about 80-some days away from her release after serving nearly 2 years. We have children in our correctional facilities at this point. So who could be considered for early release at this point?
Well, we're just coming close to having the policy specific, so I'll have to wait to give you the details for a few days. But generally, we're looking at nonviolent offenders who are nearing their appropriate release date, who, because of age or health conditions, have a higher risk of potentially contracting the disease and having a fatal result. And the parameters of that, we're still developing to be able to come up with a definitional aspect of this, and then determining how much of those numbers would allow the department to increase isolation space in the event that there are further infections. So we're looking at all those things, and we hope to be able to have more precise information for you in a few days.
And Governor, the Secretary would like to answer.
Yeah, Steve, go ahead.
No, actually, you answered it probably better than I was going to, sir. So, yeah, that's still evolving, and that is a very good generalization. Know that for the pressured individuals we have with the WAVY program, that is, we consider that precious cargo, and so we're watching that very closely and looking at individuals that are housed there and seeing if there's opportunities to move people along earlier. It's a relatively small number of individuals.
Any final words, Governor?
No, I want to thank you again. I hope you will enjoy our sunshine a long ways away from other people, and I hope you'll remain part of this incredible effort our state is making that is having success, and we want to keep that success in the days and weeks to come. And I hope everybody will remain part of the Washington team. Thanks a lot. Wash your hands, please.